What's up, guys? Jason Coley here, team-elitefts.com and Performance Recovery Systems. We're talking about the 90-90 lying position with hip internal rotation. This is the first exercise of the three you should do. You're going to be on your back, feet are going to be against the wall at 90 degrees, hips are going to be internally rotated, so slightly out. And I'll kind of walk you through and take you through what I'm doing here, talk about the points of emphasis, and about how many reps and sets you guys should do. So go ahead and put yourself on your back at about 90 degrees. Make sure your head is about even with your spine. 90 degrees at the hips, okay? Make sure your feet, knees are there. So we're gonna rotate slightly out, not rotate your feet, just rotate internally at the hips. Try and keep your feet square, so up and down. You don't want them rotate, that's a compensation. So rotate in. Foam roller works. I'm at home right now, so pillows are just fine. So squeeze with the legs. It's going to help turn on the adductors. Okay, most of the times that we talked about, the adductors are turned off, okay, because of hip external rotation and anterior tilt of the pelvis. So a little bit of internal rotation. You'll definitely feel some tightness in the hips if you have this limitation. What I want you to do is take your low back and kind of drive it into the ground so you have a nice posterior tilt. All right, rib cage is not extended. We're depressed. Okay, we're taking a nice big breath diaphragmatically through our belly. So it's in through nose. Exhale. Maintain pressure on the foam roller, or in this case the pillow. Now you don't want to get into the hip lift yet, or the pelvic tilt, so just kind of keep your pelvis nice and neutral and make sure it has a slight tilt, but keep your tailbone on the floor. If you want to give yourself some extra pressure to kind of turn on internal external obliques and transverse abdominis like we talked about, just give yourself a little bit of harbor of expiration, so it looks like this. Okay, so do that for about a minute to 3 minutes of consistent diaphragmatic breathing. Again, make sure you have a nice constant pressure on the foam roller, in this case the pillow, of the adductors. Make sure your hips are internally rotated, but your feet are not externally rotated. Good contact, neutral pelvis with your low back and the floor. Again, rib cage is not extended. Make sure you're breathing diaphragmatically through your belly, not into your chest, so you're not extending. And again, this is the first exercise of the three that we'll be doing for your lower body mobility, stability in a pinch series. Thanks.